Hello and welcome to this vlog on fibrous dysplasia. Fibrous dysplasia is a rare bone disorder that affects the growth and development of bone tissue. In this vlog, we will discuss what fibrous dysplasia is. What is fibrous dysplasia? Fibrous dysplasia is a rare bone disorder that affects the growth and development of bone tissue. It is caused by a genetic mutation that affects the normal development and growth of bone tissue. The mutation causes abnormal growth of bone tissue, which leads to the formation of fibrous tissue and weak, brittle bones. The condition can occur in any bone, but it is most commonly found in the skull, ribs, and long bones of the arms and legs. The symptoms of fibrous dysplasia can vary depending on the severity of the condition, and there is no cure for the disorder. However, there are several treatment options available to manage the symptoms and improve the quality of life for those affected. Please like and subscribe to our channel and click bell icon to get more health updates. Causes of fibrous dysplasia. Fibrous dysplasia is caused by a genetic mutation that affects the normal development and growth of bone tissue. The mutation occurs during fetal development and is not inherited from parents. In most cases, the genetic mutation happens spontaneously, and there is no known way to prevent or predict it. However, in rare cases, the condition can be inherited from a parent with the condition. The mutation causes abnormal growth of bone tissue, which leads to the formation of fibrous tissue and weak, brittle bones. Other factors, such as hormonal changes, may also play a role in the development of the disorder, but their exact contribution to the condition is not fully understood. Symptoms of fibrous dysplasia. The symptoms of fibrous dysplasia can vary depending on the severity of the condition and the location of the affected bones. Some people may have no symptoms and the disorder may be discovered incidentally during routine medical imaging. Other people may experience one or more of the following symptoms: pain or discomfort in the affected bones, swelling or deformities of the affected bones, limited range of motion or difficulty moving the affected bones, fractures or increased risk of fractures in the affected bones, deformities of the face or skull in cases where these bones are affected, hearing or vision problems in cases where the bones around the ears or eyes are affected. It is important to note that not everyone with fibrous dysplasia will experience symptoms, and some people may have only mild symptoms that do not significantly affect their daily life. Diagnosis of fibrous dysplasia. The diagnosis of fibrous dysplasia is based on a combination of medical history, physical examination, and imaging tests. During the medical history, the doctor will ask about symptoms, family history, and any previous medical conditions or treatments. The physical examination will involve a thorough evaluation of the affected bones, looking for signs of swelling, deformities, or limited range of motion. Imaging tests are an important part of the diagnosis of fibrous dysplasia. X-rays can show areas of bone thinning or thickening, as well as any fractures or deformities. CT scans and MRI scans can provide more detailed images of the affected bones and can help identify the extent and severity of the condition. In some cases, a bone biopsy may be performed to confirm the diagnosis. During a biopsy, a small sample of bone tissue is removed and examined under a microscope to look for the characteristic fibrous tissue that is present in fibrous dysplasia. It is important to have a proper diagnosis of fibrous dysplasia to ensure that appropriate treatment is given and to monitor any potential complications that may arise. Treatment of fibrous dysplasia. There is currently no cure for fibrous dysplasia, but there are several treatment options available to manage the symptoms and improve the quality of life for those affected. The treatment options depend on the severity and location of the condition. Observation. For people with mild or asymptomatic fibrous dysplasia, the doctor may recommend regular monitoring with imaging tests to track the progression of the condition and to look for any potential complications. Pain management. Over-the-counter pain relievers such as acetaminophen or ibuprofen may be recommended to manage pain associated with fibrous dysplasia. Surgery. In cases where fibrous dysplasia causes significant pain, deformities, or fractures, surgery may be necessary. The surgical options may include bone grafting, bone reshaping, or removal of the affected bone. In some cases, surgical intervention may be required to prevent or treat complications such as nerve compression or vision loss. Medications. Medications such as bisphosphonates may be prescribed to reduce bone loss and improve bone density in people with fibrous dysplasia. This medication may also help reduce pain associated with the condition. Hormone therapy. In some cases, hormone therapy may be prescribed to slow down the growth of fibrous dysplasia. Radiation therapy. In rare cases where other treatments have not been successful, radiation therapy may be used to slow down the growth of fibrous dysplasia. It is important to work with a healthcare provider to determine the best treatment options for each individual case of fibrous dysplasia. Thank you for watching this video on fibrous dysplasia. If you found this information helpful or have any additional insights or experiences with this condition, please let us know in the comments below. Also, don't forget to subscribe our channel for more informative videos.